that is given from parent to child. Not from parent to parent, but from parent to child, because it's a genetic inherited disorder which affects the genes in the body, resulting in an abnormal hemoglobin, which causes the sickling of the red blood cell.
So they could have children, but the children don't necessarily have to have sickle cell. They could have what, sickle cell trait?
They can have, depending on the parents' genetics, they can either have a normal hemoglobin, normal red blood cell, or they can have sickle cell disease, or they can have sickle cell trait. So what we need to do is find out and test the parent, and to actually test both parents to see if they have the normal gene, or they have the sickle cell disease, or the trait itself.
Right. So the main thing is having them, if one of the partners, or one of the husband or the wife, the spouse, has it, then it's important for them to be tested to see on what level it is. Am I correct?
That's correct.
All right, before they decide to have children.
That's correct.
Okay, that's very good. All right, now let's go on to find out what is the difference between sickle cell and sickle cell trait. I know we dealt with it a little bit here, but just see if we can clarify it.
Okay, well, let's define again sickle cell disease. Sickle cell disease is a autosomal recessive disease which requires both parents to have a recessive gene that is transferred to the child, the offspring, and then the child will have sickle cell disease. An individual who has sickle cell trait, that is someone who has only one recessive gene. That means one gene from one parent that it has sickle cell, and the other gene is normal. Therefore, the person does not have sickle cell disease. The person has sickle cell trait.
So the child, in this particular situation, on what you just described, one parent having it would be more likely have sickle cell trait.
That's correct.
Okay, all right. Sickle cell trait is transmitted through parents to children.
Right. So the trait gets transferred just like the disease. It all depends on the parent's genetic makeup and the formula, because we can get into genetics, which is not. This is not within the scope of this show. If you start doing a genetic makeup, if you start to calculate the risks and see what the outcome of the child would be, there's a possibility that the person will have a sickle cell disease, sickle cell trait, or a normal hemoglobin.
Okay, we're going to take a pause in a few minutes to recognize one of our famous black doctors as we celebrate Negro History Month, and that would be Dr. Charles Richard Drew. And before we do that, while we're setting up that presentation, I would like to ask you, what are some of the symptoms that one would be concerned that they may have the disease?
Well, first of all, what we need to do is, today, children that are born were usually tested. They should be tested for sickle cell disease, and that's just a simple blood test, okay? And if you've never been tested as an adult, that's simple. All you need to do is go to your doctor and request a sickle cell disease or sickle cell test, and then they will send that blood, send that work out. All it is a simple blood test, just like when you do a routine history and physical, we draw blood. All we need to do is add that test in. Now, what would be signs and symptoms? This usually, an individual, let's say an individual doesn't know that they have sickle cell disease, but they've had this entire, let's give an example, an adult, but all through their childhood they've been having these abnormal pains in their joints and their muscles. Well, that's a symptom. You can have, like I said, when I described the red blood cell itself, life is about structure. Structure equals function. Well, if the structure changes, then the function changes as well. The shape of the red blood cell should be round, smooth, flexible. In sickle cell disease, it's crescent-shaped, it is not flexible, and it does not flow throughout the body well. So now we have these crescent cell red blood cells floating through the bloodstream, and they start to collect and get caught and trapped in the tissues of the body, and that causes blockages, the blood, blood blockage, and then you're starting to have lack of nutrition and oxygen, and you can have all byproducts, negative byproducts in the body building up, and that will cause the pain itself, and that would be what we call sickle cell crisis. And you could have pain throughout all the major and minor organs throughout the body. There are other symptoms, like for a male, they can have what's called priapism, where they have the blood gets blocked and in their male genital region, and they have an erection for hours to days, which is not healthy.
Right.
So that would be an emergency, and they need to go to the ER to have that corrected. And usually, we try medications to decrease that, the blood flow. If not, then we need surgical intervention. That's how serious that could be, to help drain the general.
Okay, we're going to talk about being proactive towards the end of our program, but at least we let folks know that. And the reason why we have to look at this seriously is because you're talking about 1 out of 12 African Americans in this country has sickle cell trait. So that's not a light thing to look over,
right,
and something to be real concerned. Okay, folks, this is Black History Month, and we want to recognize throughout our history, we have had great doctors, and when we recognize at this moment Charles Richard Drew. Charles Richard Drew was born in Washington, D.C. on June 3rd, 1904. He received a Bachelor of Arts from Amherst University in 1926. He received a medical doctorate and Masters of Surgery from McGill University, Montreal, Quebec, and that was in 1933. In 1940, Dr. Drew received a Doctor of Science in Medicine from Columbia University. That was in 1940. Dr. Drew served as an instructor at the pathological at Howard University in 1936. Now, Dr. Drew conducted research in blood plasma for transfusion due to long life of the blood with cells removed while at Presbyterian Hospital in New York. He also, Dr. Drew, set up and ran the blood plasma bank at Presbyterian Hospital in New York, which served as one of the models for the widespread system of blood banks now in operation for the American Red Cross. He also is recognized for organizing a blood bank in London during World War II. And so we give high recognition to Dr. Charles Richard Drew and this celebration of Black History Month. Thank you. Well, Dr. Tommy O, we have two important questions that have to be answered, and that do individuals with sickle cell traits live healthy lives?
Yeah, individuals that have sickle cell trait, they live normal, healthy lives. The key here is to make sure that they, go in for their routine examinations. They eat healthy, well-balanced diet. They exercise. A diet and exercise program, and enjoy themselves, be active, have fun.
So if you go to the doctor and you say you got the sickle cell trait, that doesn't mean you go panic anywhere.
No.
All right, and it means you can live a healthy life.
Yes.
Okay.
What we're concerned about is if you do have sickle cell trait, it's when you're gonna get married and you're gonna decide to have children. You need to know what your significant other, if they have normal hemoglobin, sickle cell disease, or sickle cell trait, because that will determine the risk of your child from inheriting either the trait or the sickle cell itself. So that's the take-home factor there. If you do have sickle cell trait, you need to know, or even sickle cell, let's just say sickle cell disease as well as sickle cell trait, and you decide you're going to have children, you need to know what your significant other has, if they have it or not.
This is good. So once again, being proactive and going in and getting an examination, am I correct?
Yes.
There's no cure for this.
No, currently there's no cure. However,
there is treatment, though.
Yeah, well, we do have treatment. There is no cure, but they're working on a cure right